So the title of my talk today and of the research project is Mobilizing Austerity, the Urban Politics of Public Health After the Global Financial Crisis. And by way of a brief introduction, I'll give an overview of the research project, set out the conceptual framing, and then, since this is a comparative study across 3 cities, Athens, Budapest, and Manchester, I'll give a brief snapshot of what's going on in each city, focusing a bit more on Athens as it's the first city that I'll be examining. And then go on to talk a little bit about what I've accomplished in the 11 months as a fellow and finish off by speaking about some next steps in the research. So I'm going to begin on a serious note today with the story of a man's death. In 2012, international headlines were made when a retired pharmacist, Dimitris Christoulas, walked to the Greek Parliament building and shot himself. He had just found out his pension had been cut, and he had already experienced difficulty paying for essential medicines. His final words were, "I am not committing suicide, they are killing me." In a note later found on him, the full text of which is here, he wrote, "I see no other solution than this dignified end to my life, so I don't find myself fishing through garbage cans for my sustenance." Christoulas' death made headlines as a symbol of the growing connection between the increasingly harsh economic austerity policies imposed on the country and the social and health effects of these policies on the Greek people. While he specifically marked his death as a political one, he was not alone. Between 2008 and 2016, the suicide rate rose by 68% in Greece. In Athens, HIV rates have doubled, and between 2010 and 2011 alone, saw a 1,450% increase after funding for needle exchanges was cut. And in 2010, Greece saw its first malaria outbreak since 1970. Diminishing health trends have been directly correlated to the systematic defunding of Greece's public health and social services and rising unemployment. Both of these are direct results of economic austerity measures meant to simultaneously repay debt and run a surplus budget. Greece, as we all know, is not the only country to implement economic austerity policies after the 2008 financial crisis. Austerity, which I'm using as shorthand here for state policies seeking to reduce budget deficits through spending cuts, privatization, reducing labor costs, and reconfiguring public services and welfare provision, was widely adopted post-2008. In some cases, like in Greece, it was imposed from above by international governance organizations. Yet in other places, such as here in the UK, it was ushered in by national governments, in this case 2 years after the initial crisis hit. So this project is focused on understanding the spread and implementation of austerity policies as they relate to public health service provision in 3 European cities, Athens, Budapest, and Manchester. And the work is focused on the international mobility of austerity and the responses of cities and citizen groups to such policy change. I am interested in how networked relational urbanism is produced through the international spread of economic austerity policies and the local state and non-state responses. In the words of Doreen Massey, I'm interested in a relational politics for a relational urban space. And to that end, this research asks, how has post-2008 austerity-led restructuring altered spaces of urban public health? And what are the economic, political, and societal stresses involved in providing spaces of care in economically deprived neighborhoods as traditional forms of state service provision are disrupted through austerity-led restructuring, and the pressure for innovative urban solutions and competition for resources is simultaneously increasing? While there is a growing awareness that austerity is bad for health, the knowledge which exists is incomplete and ad hoc. Concurrently, urban public health services serving low-income people often involve contested political struggles at the local level based on stigma as well as conflicting land use pressures within the city. And these struggles intensify through the dual pressures of economic downturns and the restructuring of public health services, which are often the first to be cut despite being generally understood as cost-effective social interventions. Theoretically, this project brings together the burgeoning work on austerity urbanism local politics and urban policy mobilities. So focusing on understanding contemporary cities through the effects of intensified localism under neoliberal state governance, austerity urbanism has been critiqued for too heavily focusing on economic process, leaving little room to understand how local urban politics are imbricated within these social processes and understandings of city making, and how neglecting local politics in broader political economic analysis also obscures the nuances of mediations of and resistance to neoliberal logics. These debates are rooted in a wider, long-standing discussion about the mutually constitutive relationships between cities and global economic processes. So another strand of work which has taken up these debates is that of urban policy mobilities. This literature focuses on the social processes of circulating models and expertise among places and the political struggles around turning these models to specific local contexts. Taking a global relational approach developed by scholars such as Doreen Massey and Alan Cochrane, work within the frame of urban policy mobilities attempts to overcome a critique of what Ugo Rossi has called a mere gesture to the global context whilst focusing on the minutiae of urban politics. Bringing these two approaches together, this is a project which attempts to broaden, or you might say globalize, understandings of local governance while providing careful accounts of local politics in order to overcome austerity urbanism's tendency to neglect these local mediations and resistances, as well as struggles facing the importation and, in some cases, the imposition of policies from elsewhere. Focusing on the local struggles of cities to provide care in the face of state restructuring provides a lens through which to study the nexus of global-local relational city-making. As well, it will bring into focus spaces of urban public health service, which are often neglected yet vitally important spheres within cities. Methodologically, the study is framed by a relational comparative approach, which understands localities as both distinct and comparable, but also co-constituted through wider networks. Conceptually, a relational comparative approach, I argue, is useful rather than engaging in a cross-case comparison to signify either the irreconcilable and uniqueness of places or that their differences are simply local variations of wider logics. It will allow the cases to be analyzed in their formation to each other, illuminating not only individual instances of austerity urbanism, but also shedding light on the wider processes of austerity throughout Europe and globally. So this project triangulates policy, gray literature, and media analysis with semi-structured interviews with stakeholders and observations in each of the three cities. The policy analysis focuses on two areas: economic austerity and public health policies for each of the three cities, in order to identify key services and local as well as global political debates within each city. And I should say that the work today, this is where much of my work up to now has been focused. I'll be beginning fieldwork interviews in Athens in a few weeks' time. So Athens is where I'll begin to talk about the situation in each place. So since 2009, the Greek economy has reported the highest debt in the European Union at 179% of GDP, and is currently in the process of receiving its fourth financial bailout under rapidly increasing and nationally contested austerity measures. The Greek crisis was triggered by a perfect storm of the 2008 global financial crisis, pre-existing structural weaknesses within the economy, and its chronic underreporting of its national debt. It was sanctioned for that the first time in 2004, well before the crisis hit. Between 2010 and 2016, the national government has enacted 12 rounds of tax increases, spending cuts, and economic reforms, what we would call austerity policies. Many of these moves have come as conditions imposed from the three economic bailouts which the country has received from what's been called the Troika, the IMF, the Eurozone, and the European Central Bank in 2010, 2012, and 2015. Public health programs, including medical outreach, planned increases in community health clinics, and needle exchanges in Greek cities were among the first casualties of the budget cuts under austerity measures, leading to the rapid increase in disease transmission. Between 2009 and 2013, spending on health was cut by 32%. So, as I mentioned above, rising HIV rates in Athens have seen increases of over 1,000% within the period of 1 year. And additionally, researchers have clearly documented declines in health in Greece linked to the financial crisis, which was, of course, exacerbated by pre-existing record unemployment and poverty rates. And therefore, Athens really represents an extreme case of austerity, and which is why it's one within a broader field. Athens is home to 40% of Greece's population, and its health system, like all of the health systems in this project, is a national universal healthcare system, or it tries to be. Primary and public healthcare delivery is through district health clinics, and there have been many varied responses to the deep cuts to health services within Athens. And like the bailout packages, Athens' responses to health cuts have come in 3 waves, which I have provisionally termed experimentation, retrenchment and revanchist, and resistance. And I say provisional here because, again, this thinking is based right now on preliminary analysis. Could all change as soon as I go into the field. And so what you can see here are several examples of each local response. So the first wave of responses came from the local level and can be characterized as experimental. Athens doesn't have a strong history of collaborative governance and civil society, and rather since World War II, the country has swung between the rule of centralized authorities, including a monarchy and military dictatorship, and political instability, with the national government really only starting to stabilize in the mid-1980s. So, and local authorities were, until 2010, legally restricted in their capacity to formulate local policy. A 2010 law allowed for more power within decision-making in municipal governance, but unsurprisingly, there were no accompanying resources to enable such legislations to reach its desired effects. So the first stage of experimental response to austerity cuts was very much rooted in state-centered solutions, though not all of them. So for example, in order to combat the HIV outbreak of 2011, the government, with the full support of the mayor of Athens and the local police force, allowed a controversial pilot program to begin in an existing health center for HIV-positive drug users, a supervised drug injection room. And this ran for 2.5 years in the city center. Like all of the other 90 or so existing consumption rooms across the globe, this program very quickly began reporting lower rates of HIV cases within the immediate district, lower rates of discarded needles in the neighborhood, and higher rates of people accessing housing services and drug treatment when it was available. Another example outside of the state is the network of physiological solidarity and support, which provides free mental health services in the community. It began in 2010 by mental health professionals who found themselves out of work and who drew on their own professional networks to continue providing services in Athens. So between 2009 and 2011, there was a 14% decline in health spending, which saw many services with reduced hours or closing their doors completely. And so such urban experiments were permitted by the state, seemingly as an attempt to deal with drastically cut services, with the government really just looking the other way. However, as the crisis did not begin to improve, but rather deepened, state officials faced an increasingly angry citizenry and renewed budget cuts from the second bailout agreed in 2012. The local response seems to exhibit a period of retrenchment and revanchist tendencies. So, for example, while the drug consumption room program was seeing successes in stemming disease transmission, and the organization was making plans to expand by seeking international funding, the new health minister, together with the prosecutor general, forced the program's closure in 2014, noting that they could not be spending money on promoting illegal behavior, drug use. The new policy that they implemented instead made international headlines and was condemned by the World Health Organization as both unethical and potentially in violation of human rights. In a very public display, the health minister and police arrested local sex workers and forcibly tested them for HIV. The women's photos, and they only arrested female sex workers, were subsequently published along with their test results in the national media. The policy for forced testing of sex workers, drug users, and immigrants remains in place. Additionally, the government began to crack down on the informal health networks, which had sprung up, forcing organizations run largely on unemployed volunteers to look for funding and register within the National Health Service or risk criminal charges. Some closed, some quietly moved elsewhere, and some, such as the Network of Physiological Solidarity and Support that I mentioned, were able to secure international civil society funding in order to establish themselves more formally. This about-face of the informal health collectives, coupled with a 2015 referendum on the third bailout package, which was disregarded by the national government, caused deep fractures within the civil society that had sprung up in the wake of austerity, with many groups eschewing any form of state help, including help from the progressive mayor of Athens, who had been supportive of urban experimentation and various forms of informality, but was unable to put any resources towards it. So, from 2015 up till now, it appears that local responses are fractured from the local state, from civil society groups, and from non-state organizations. They have been increasingly formulated in direct resistance to existing national state health policies. So international nonprofit funding from a state perspective and civil society perspective has increased, and with many funding sources such as the Bill and Melinda Gates Foundation or George Soros's Open Society Foundations have begun stepping in, and these are organizations that already have a long history of funding public health interventions. Additionally, reports of growing grassroots health clinics that eschew any form of state intervention post-2015 have emerged in the media, and the municipal government of Athens, from the local state level, has launched several collaborative governance initiatives, mainly, however, by providing space through networks. Though a notable example includes the Solidarity Hub, which provides basic food services and health services to about 8,000 participants facing severe poverty in Athens. So if cities are, as Jamie Peck has said, where austerity bites, then it appears, in the case of Athens at least, that this is fully evident. And here you can see this was actually, I pulled this off, this was yesterday, there was a national strike in Greece, which again was called in part by the doctors' union and the two other labor unions, which have been organizing the strikes against the new austerity measures that are currently on the table. So the situation in Budapest is somewhat different. Prior to 2008, Hungary's post-socialist economy was relatively strong, unlike Greece. However, the shock of the 2008 crisis was particularly acute due to heavy foreign currency debt. As a result, Hungary was actually the first European Union country to receive a financial bailout from the IMF, which in turn led to significant cuts to the 2008 national health budget. Although subsequent overall health spending has remained stable, extra stressors to the system have included increased unemployment and increased urbanization, particularly within Budapest. Previous research that I have undertaken there shows evidence of increased demand for low-threshold public health services as early as 2011. So local authorities, including Budapest, also own their own hospitals and are responsible for healthcare service provision, which has led to geographically uneven care provision and access, not only between the urban and the rural, but also within cities. Since 2010, the national government has pushed a privatization agenda in healthcare, transitioning the system to an explicitly single-payer model in 2011. From 2010 to 2013, parts of the public health budget, which was split across health, social care, and law enforcement budget packages, was suspended as the newly elected government reviewed and, in most cases, reorganized policies dealing with public health and social care budgets. Therefore, despite no significant change in healthcare spending percentages, budget allocations have been significantly reoriented away from public health and primary care services. Since many of the primary healthcare facilities, as well as public health outreach for marginalized communities, such as the Roma, street youth, sex workers, and drug users, have been shuttered due to funding cuts, which have been in part attributed to austerity policies. It appears that many of the health services which are operating in the 8th and 9th districts and on the outskirts of the city have in fact transitioned to mobile outreach teams, which would severely impede the local community's access to health services. So, turning now briefly, austerity programs in the UK. Austerity was a very relative latecomer, and it was introduced in 2010, where 85% of the budget consisted of spending cuts, which was reducing expenditure by 85 billion pounds. And I'm actually going to skip through some of the statistics here, because I think I'm running close to time. But the important point for the UK, and I'm happy to talk about this more in the question period, is that it has begun a process of devolving budgetary powers to local and regional authorities, starting in Manchester with a £6 billion combined health and social care budget, which will be administered by its first ever elected mayor, Labour's Andy Burnham, who is also a former health secretary. Manchester is being watched very closely to see what sort of model of service provision will prevail, as it is likely to serve as a forerunner to 5 other regions set to take over their own health budgets in the coming years. And it seems likely that, despite protests led by groups such as the People's Assembly and Save Our NHS movement, contractualization will form a large part of a devolved NHS, barring any surprises in the upcoming election. So I'll skip now and just say, in terms of next steps, I'm just about to begin fieldwork in Athens, doing interviews, 15 to 20 in each city, with different policymakers, health service providers, various advocates, and other stakeholders, as well as observation site visits to health clinics, community meetings, etc., and of course continued policy and media analysis. And I hope to do 2 rounds of fieldwork. So the first one will last for about 2 weeks this summer, or spring-summer, and into September, and then another 2 to 3 weeks back in January as well. And beyond that, some other selected activities that I've been up to over the past 11 months, a few forthcoming publications, 2 papers, one on the everyday proper politics within state and non-state spaces around drug policy reform, and a piece on minor theory and relational urbanism, which is part of a symposium on Cindy Katz's Towards Minor Theory. And then 2 book chapters on policy mobilities, one co-authored with Kevin. Also co-organizing a conference session at the upcoming RC21 on urban social policy as struggle for social justice, and have just put in a special issue proposal for urban geography on the urban politics of policy failure. So, and there.